You know that feeling when food just doesn't seem to go down right? Maybe gets stuck?
Uh-huh.
Well, today we're taking a really close look at a condition where that's not just a once-in-a-while thing,
Yeah.
but a serious ongoing challenge for some of our pets, both dogs and cats. It's called Megaesophagus.
Yes, Megaesophagus. It's fundamentally a problem with, how food gets from the mouth down to the stomach.
Okay.
So if you picture the esophagus, that tube connecting the two, it basically becomes enlarged, widened, and it loses its ability to squeeze food down effectively. Those squeezing motions, we call them peristalsis.
Circumstances, right.
And in Megaesophagus, those are rare or sometimes completely absent.
Okay, so if we think about that food highway again, it's not just that the road's gotten wider, but the crew pushing the traffic along, those muscles, they've kind of stopped working properly.
That's a really good way to put it. Normally, when an animal swallows, food entering the esophagus triggers sensory nerves. Think of them as the foods here, messengers. These nerves send signals up, involving the glossopharyngeal and vagus nerves, up to the brain. The brain processes this, sends signals back down the vagus nerve, telling the esophageal muscles, okay, contract, move it along.
A whole communication chain.
Exactly. But in Megaesophagus, this entire pathway can be disrupted. And what's really interesting, in many of the cases where we can't find a specific cause, the idiopathic ones, there's some thinking that the issue might actually start with those initial sensory nerves. The food's here. Signal isn't getting sent properly.
Huh. So the esophagus just isn't getting the message to start moving. Now, you also mentioned, or our source material does, that can be focal or diffuse. What does that difference tell us?
Yeah, that's an important distinction. It often points towards the type of underlying problem. So diffuse Megaesophagus means the widening affects, pretty much the whole esophagus.
Top to bottom.
Right. But focal Megaesophagus is when only a specific section is widened. And that localized widening can sometimes be a clue suggesting there might be a physical blockage further down, like a bottleneck, causing the area above it to stretch out over time.
Ah, like a traffic jam backing everything up.
Oh.
So if you're a pet owner listening, what are the key things you might actually see that would make you think, maybe this is more than just, my dog eating too fast?
Well, the absolute hallmark sign, the one that really should ring alarm bells, is regurgitation.
Regurgitation.
And it is so crucial to understand how this differs from vomiting. Regurgitation is passive.
Passive, how so?
The food just seems to come back up, often relatively easily, maybe coated in some mucus. There's usually no warning, no nausea signs like lip licking or pacing, and really importantly, no abdominal effort, no heaving beforehand.
So it just sort of flows back out.
Kind of, yeah. Think of maybe how a baby spits up that's closer to regurgitation. Vomiting, on the other hand, that involves active abdominal muscle contractions. It's forceful.
Okay, that passive part is a really key distinction. So if you see your pet just bringing food back up without that whole production, that's a big clue. What else might someone notice?
Well, you might also see difficulty swallowing itself. We call that dysphagia.
Dysphagia.
Yeah, it could look like they're struggling to eat, maybe chewing excessively without actually getting the food down, or food even just falling out of their mouth. Coughing or maybe some nasal discharge can also be warning signs. These are worrying because they could indicate aspiration pneumonia.
Ah, the food going down the wrong way into the lungs.
Exactly, a very serious complication. Then there are changes in appetite. Some pets might seem ravenous, always hungry, because they're not actually getting the nutrition into their system effectively.
Right.
Others might lose interest in food altogether. You might also see excessive drooling, ptyalism, that's the technical term, and even bad breath. Halitosis can sometimes be linked, from food just sitting in the esophagus.
And the source material we looked at even pointed out some less obvious things, signs you might not immediately connect to an eating problem.
That's right. Things like general weakness or exercise intolerance, just getting tired more easily than usual.
Okay.
And even a change in their bark or meow, a change in voice dysphonia. These can sometimes be linked, especially if there's an underlying neuromuscular issue affecting nerves and muscles more widely, not just in the esophagus.
Wow.
And one more thing sometimes, though not always, you might actually be able to feel a sort of swelling in the neck area, which could indicate a distended cervical esophagus, the part in the neck.
It really is like a cascade, isn't it? One problem leading to others that seem unrelated. So let's dig into the why. The source breaks down causes into two main buckets. Congenital, born with it, and acquired, develops later.
Yep, that's the standard way we think about it, trying to figure out the origin.
Okay, starting with congenital, It sounds like genetics can definitely be involved sometime.
Yeah.
Oh, absolutely. We know there are inherited forms in certain breeds. For instance, wire-haired fox terriers, it seems to follow an autosomal recessive pattern.
Meaning they need the gene from both parents.
Correct. And in miniature schnauzers, it looks like it might be autosomal dominant or maybe incompletely recessive, potentially needing only one copy of the gene. The source also lists several other breeds where it's been reported congenitally.
Right.
And besides those breed-specific inheritances, there's also congenital myasthenia gravis. That's a neuromuscular disorder they're born with, which is a known cause in breeds like Jack Russell Terriers and Springer Spaniels.
Okay.
And then, well, sometimes puppies are just born with it. And despite all our tests, we can't find a specific reason. That's what we call idiopathic congenital Megaesophagus, just born that way.
Like the wiring wasn't quite right from the start. Okay, now moving on to acquired Megaesophagus. The source suggests this is actually the more common form that vets see.
Yes, acquired is definitely diagnosed more often. And interestingly, just like the congenital form, the most common reason in adult dogs and cats is also idiopathic.
Really? Still unknown in many cases.
Still unknown. We just don't know why it develops in those particular animals. But there are definitely a number of other potential underlying medical conditions that we absolutely need to look for.
And it sounds like neuromuscular disease is a really big category there.
They really are. Myasthenia gravis, MG, that's a major one. It's estimated to be behind maybe 25% or so of acquired Megaesophagus cases in dogs.
And MG is autoimmune, right? The body attacks itself.
Exactly. The immune system mistakenly attacks the communication points between nerves and muscles. But MG isn't the only possibility. You have other things like systemic lupus erythematosus, SLE, or different kinds of myositis, which is inflammation of the muscles.
Affecting the esophagus, too.
Yes. Dysautonomia, a problem with the autonomic nervous system that controls involuntary stuff. That's another one. Though maybe seen a bit more in cats. Even something like botulism, the food poisoning, can interfere with nerve function enough to cause it.
Wow. The source also mentioned a direct link between the brain itself and the esophagus. How does that fit in?
Right. So problems that affect certain cranial nerves, specifically cranial nerve IX, the glossopharyngeal, and cranial nerve X, the vagus nerve, or the pathways these nerves use within the brainstem, can definitely lead to Megaesophagus.
Because those nerves control swallowing and the esophageal muscles.
Precisely. They are vital for coordinating the whole complex process. If the signals get scrambled or blocked, the esophagus just won't work properly.
And it's not always these sort of internal communication breakdowns, is it? Physical blockages can cause it, too.
Absolutely. Physical obstructions are a key thing to rule out, especially with that focal type we mentioned. They literally stop food from passing normally, causing the esophagus above the blockage to dilate.
Makes sense. What kind of blockages?
Well, you can have vascular ring anomalies. Those are congenital issues where blood vessels wrap around the esophagus and constrict it. Then there are tumors, either inside the esophagus or pressing on it from outside, like lymphoma, or a muscle tumor called a leiomyoma.
Yes.
Strictures, too, those are narrowings, often from scar tissue after an injury or severe inflammation, swallowed foreign objects, obviously, and even granulomas, which are inflammatory masses. These tend to cause that more localized focal megaesophagus.
Some of the other potential causes listed were, well, kind of surprising, like toxins and even hormone issues.
Yeah, it's a broad list. Certain toxins, things like lead, thallium, some insecticides, even acrylamide can interfere with nerve and muscle function, potentially impacting the esophagus, and endocrine disorders.
Well, the link isn't always perfectly clear, but there seems to be an association with conditions like hypocorticism, that's Addison's disease, and maybe sometimes hypothyroidism with acquired Megaesophagus. Still needs more research, but the connection is noted.
And then there was that interesting link with thymomas, especially in cats. Yes, the thymoma connection is quite intriguing. Thymomas are tumors of the thymus gland, which sits in the chest, a mediastinal mass.
Okay.
And there's a known link between thymomas and both myasthenia gravis and Megaesophagus, particularly in cats. Maybe around 25% of cats with Megaesophagus might also have a thymoma.
Suggesting an immune system connection again, since the thymus is involved in immunity.
That's the thinking, yes.
Right.
The immune system is involved somehow. The source also briefly touches on links with other things like GDV or bloat, hiatal hernias, and esophagitis inflammation, which could be from reflux or even parasites sometimes.
It really, really sounds like figuring out why a pet has Megaesophagus can be serious medical detective work.
Yeah.
So once a vet suspects it, What's the diagnostic journey look like?
Well, step one, absolutely crucial, as we said, is nailing down whether it's truly regurgitation or vomiting. Getting that history right is key.
Based on those characteristics, passive versus active.
Exactly. Then routine blood work and urine tests. Now, often these might actually come back normal, but sometimes they can give clues. You might see changes suggesting lead poisoning or electrolyte imbalances pointing towards Addison's, or maybe elevated muscle enzymes hinting at a muscle disorder. They help build the picture.
And are there more specific lab tests they might run?
Oh, definitely. The acetylcholine receptor antibody titer, that's the main screening test for myasthenia gravis. It's usually recommended for pretty much any suspected Megaesophagus case.
Looking for those antibodies attacking the nerve-muscle junctions.
Precisely. It's a good test, though very occasionally you can get a false negative. So you might repeat it if you're still suspicious. And then, depending on other signs, tests for Addison's, thyroid function, lead levels, maybe markers for autoimmune diseases like lupus might be run.
Okay. Now, imaging seems like it would be absolutely vital to actually see the esophagus.
Oh, imaging is critical, usually starting with chest x-rays, thoracic radiographs.
What do they show?
They can often show a dilated esophagus, maybe filled with air or fluid or food material. You do have to be a little careful interpreting them because a very stressed or anxious animal might swallow a lot of air, making the esophagus look temporarily widened.
Right.
But x-rays are also crucial for looking for complications like aspiration pneumonia. You might see changes in the lung fields. And sometimes they reveal underlying causes, like a visible mass in the chest or signs of a hiatal hernia, though standard x-rays alone can't tell you if it's MG causing it, for example.
So you need more details sometimes. What about those contrast studies like esophograms or video fluoroscopy?
Yeah, those give us more functional information. In an esophagram, the pet swallows barium, or sometimes another contrast agent like iohexol mixed with food or liquid.
And the barium shows up white on the x-ray.
Right, so you can watch how it moves or doesn't move down the esophagus. You can see pooling, assess motility, look for structural problems like strictures. We do have to be cautious, though.
Because of aspiration risk.
Exactly. Giving liquid contrast to an animal that struggles to swallow normally carries a risk, especially if they might already have pneumonia. But video fluoroscopy, that's even better in some ways.
How so?
It's basically a moving x-ray movie. You can watch in real time how the esophagus contracts or fails to contract as the animal swallows the contrast. It's incredibly valuable for assessing how severe the motility problem is, and it can even help figure out the best food consistency, like does liquid move better than solids, or vice versa, which is huge for management.
That makes sense. And sometimes I guess you need to actually look inside the esophagus.
Yes, that's where esophagoscopy comes in, using a flexible endoscope with a camera.
What's that used for?
It lets you directly see the lining. It's great for finding and maybe even removing foreign objects, getting a close look at suspicious lumps or bumps to see if they look like tumors, assessing inflammation or esophagitis, or identifying strictures.
And for those nerve and muscle issues you mentioned earlier, are there specific tests for those?
There are. If a neuromuscular disease is high on the suspicion list, we might consider electrophysiology tests like EMG that measure electrical activity in muscles and nerves. Muscle and nerve biopsies can also provide detailed information.
Okay.
And if we're worried the problem originates in the brain or spinal cord, then maybe CSF analysis looking at the spinal fluid or advanced imaging like an MRI or CT scan of the brain might be needed. Oh, and sometimes, depending on where you live and the signs, fecal exams to check for specific parasites that can affect the esophagus.
So it's a really comprehensive workup to try and pinpoint the why, which must then guide the treatment, right? Once you have a diagnosis, what does the management plan look like?
Well, the absolute number one priority is always, can we identify and treat an underlying cause? If it's MG, treat the MG. If it's Addison's, treat the Addison's.
Makes sense.
But regardless of the cause, or even if it's idiopathic, the two main pillars of managing the Megaesophagus itself are, 1, meeting the animal's nutritional needs, and 2, preventing aspiration pneumonia.
And I imagine that nursing care becomes really important, especially if they do develop pneumonia.
Oh, absolutely critical. Aspiration pneumonia often needs supportive care, maybe oxygen therapy, sometimes nebulization or chest physiotherapy to help clear the lungs, IV fluids for hydration.
Right.
Positioning is also key. Keeping them lying on their chest, what we call sternal recumbency, or turning them regularly if they can't move themselves, helps prevent fluid from pooling in one part of the lungs. Interestingly, though, unless there's another reason related to an underlying condition, restricting their general activity level usually isn't necessary.
Okay. Now let's talk diet. This sounds like it must be a huge part of managing Megaesophagus.
It is absolutely fundamental, and finding the right approach often involves, frankly, some trial and error.
What do you mean?
What works best in terms of food consistency varies a lot between pets. For one dog, a thin liquid gruel might work best. For another, maybe small, soft meatballs that they can swallow whole are better, or a blended slurry. You have to experiment.
Finding what goes down and stays down most easily for that specific animal.
Exactly. In some situations, especially if maintaining nutrition is really difficult, a gastrostomy tube, a feeding tube going directly into the stomach, can be a lifesaver for getting calories and meds in.
But you mentioned that doesn't stop all risks.
Right. It ensures nutrition gets in, but it doesn't prevent them from potentially regurgitating or aspirating their own saliva, which can still happen.
Okay, and how they're fed is crucial too.
Paramount. Elevated feeding is key. This means feeding them with their front end raised, usually at a 45 to 90 degree angle relative to the ground.
So gravity helps the food go down.
Precisely. And then, this is just as important, keeping them in that upright position for about 10 to 15 minutes after they eat or drink. To give everything time to get down into the stomach, there are actually specialized feeding chairs, often called Bailey chairs, designed specifically for this.
Wow. It really sounds like managing this condition takes an incredibly dedicated owner.
It absolutely does. Most cases, especially idiopathic ones, require lifelong management. It takes a huge commitment from the owner sticking to that feeding protocol, watching closely for any signs of pneumonia, working hand in hand with their vet. Their dedication is probably one of the biggest factors influencing the pet's quality of life and outcome. Sadly, even with the best care, complications like recurrent pneumonia can still be major issues.
Are there ever surgical options that can help?
Surgery plays a role in specific situations, yes. For those vascular ring anomalies we talked about, surgery to correct the constriction is the way to go.
Okay.
Surgery might also be needed to remove certain obstructions, like foreign bodies or some tumors, and removing the thymus gland, a thymectomy, might be part of treating MG and Megaesophagus if a thymoma is present.
Right.
For strictures, sometimes balloon dilation using an endoscope to stretch the narrowed area can help. But, and this is important, surgically removing the enlarged esophagus itself for diffuse Megaesophagus, that's generally not recommended or effective.
Okay. What about medications? What's their role?
Medications are mainly for managing complications or treating those underlying causes. So antibiotics are obviously crucial if aspiration pneumonia develops.
Naturally.
If it's an immune disease like MG, you might use immunosuppressants, though carefully if pneumonia is active. There's a specific drug, pyridostigmine, that helps nerve muscle communication in MG. Steroids are needed for Addison's.
Cool.
For managing esophagitis, that inflammation from food sitting there or reflux, acid reducers like H2 blockers or proton pump inhibitors are often used.
And what about drugs to make the esophagus move better? Prokinetics.
Ah, yes. Prokinetics are generally avoided in diffuse Megaesophagus.
Why is that?
Because some of them can actually tighten the sphincter muscle at the bottom of the esophagus, which could potentially increase the risk of aspiration by making it harder for anything to get into the stomach.
Huh.
They might have a very limited role in some specific situations, like managing reflux if Megaesophagus isn't the main issue, but generally we steer clear for diffuse cases.
Got it. Anything else about meds?
Just that absorption of oral drugs can be unpredictable because things might not stay down or get absorbed properly from the dilated esophagus. So sometimes injectable forms of medication are needed instead.
Right. Another complication to manage. So it's a very tailored treatment plan, isn't it? Depending on the cause, the individual pet. What does the long-term picture usually look like?
Well, ongoing monitoring is essential. Regular vet checkups, keeping a close eye on their weight, and definitely repeating chest x-rays if there's any hint of pneumonia returning.
Okay.
For some congenital cases, especially in certain breeds like miniature schnauzers, you can sometimes see spontaneous improvement as they mature, so follow-up x-rays are useful there too. And obviously, trying to prevent them from swallowing things they shouldn't, like bones or toys that could become foreign bodies, is important long-term.
And the biggest worry remains pneumonia.
Aspiration pneumonia is always the major concern, yes. It's often the reason for a decline or euthanasia, unfortunately. The overall prognosis really depends heavily on whether an underlying cause can be found and treated effectively.
So better if you find the why.
Generally, yes. Congenital cases often have a more guarded outlook, though, as I said, mini schnauzers might do a bit better. For acquired MG cases, maybe half the dogs respond well to the MG treatment, but the megaesophagus itself might not fully resolve, even if the other MG signs do. And sadly, for the idiopathic adult onset cases where we don't find a cause, the prognosis is often considered poor to guarded, which just highlights, again, how crucial that dedicated owner care is for maximizing their time and quality of life.
It's definitely a challenging condition, no doubt about it. But it sounds like with really diligent management and that strong partnership between the owner and the vet team, some animals can still have a decent quality of life.
Absolutely.
So just to kind of wrap up the key takeaways, we've learned that megaesophagus in our pets is, well, it's a complex issue. It's about this weakened, enlarged esophagus leading to that passive regurgitation and the really serious risk of aspiration pneumonia.
Right.
It can be something they're born with, or it can develop later. And there's this huge range of potential causes: genetics, nerve and muscle problems like MG, physical blockages, even toxins or hormone issues.
A real diagnostic puzzle sometimes.
Yeah, and figuring it out involves careful history, imaging like x-rays and contrast studies, maybe specific lab tests. And then the management really focuses on getting nutrition in safely finding the right food consistency, using elevated feeding with things like Bailey chairs, and constantly being vigilant about preventing pneumonia.
Yeah.
And it really does take a huge, often lifelong commitment from the owners.
You've summed it up perfectly. And when you think about the incredibly intricate coordination required between the nervous system and the muscles just to get food down, and how that gets disrupted in megaesophagus, it really underscores how these seemingly simple bodily functions rely on such complex biological pathways. Understanding these connections is just so fundamental, isn't it? It makes you wonder what other everyday functions depend on that kind of delicate dance.
That's a really fascinating point to end on. The hidden complexity in this is seemingly simple. If this deep dive has piqued your interest, we definitely encourage you to maybe look more into some of those specific underlying conditions we mentioned, like myasthenia gravis, or even explore the broader field of neurogastroenterology, the whole nerve-gut connection.
Always more to uncover.
Absolutely. There's always more to learn when you dig a little deeper.